Hi, I'm Dr. Mohan Thomas, and I'm American trained and board certified, triple board certified, general cosmetic surgeon as well as a facial plastic surgeon. I'm going to be talking to you about rhinoplasty today. What is rhinoplasty? Rhino meaning nose, and plasty means reshaping of the nose. Why is this topic so important? It is the most commonly done procedure worldwide. Unfortunately, it is also the most commonly reoperated part of the human body. I've had patients come to me that have been operated 10, 12 times and coming to seek for the 13th or 14th time. Now, why does this happen? We should always, as surgeons, be aware that there is something called BDD, body dysmorphic disorder. It's an obsessive psychological disorder. There are three questions I generally pose to my patients. Question number one: do you think about your nose all the time? If the answer is yes, that's the first red flag. Question number two: do you think about this nose when you go to sleep as well as when you wake up in the morning? If the answer is yes, that's the second red flag. The third question is: do you think after this nose is done that your life is going to improve professionally and personally? So if you get three red flags, one or two red flags, this patient needs to see a psychologist because this is a mental issue that needs to be managed with either with psychological counseling or even medications before you embark on this procedure. Some people come in before because they have difficulty in breathing. The septum, which is found in the middle of the nose, like a hole in a tent in the middle, can be deviated to the right or the left. And if that's the case, they will have difficulty in breathing. Now, if there is an aesthetic component to it, they don't like the way the nose looks. It's upturned, it's short, it's long, it is twisted to the right or left. These are other reasons. So, technically speaking, if you do a rhinoplasty, you can get both a functional as well as an aesthetic improvement. The investigations should start with a good, well experienced, and skilled surgeon. I've been doing this for a long, long time. I've written several textbooks on rhinoplasty, so I consider myself an expert. However, you can find your own. Once you see the doctor, then a good clinical examination, some very good photographs taken that it can be projected on a screen, and both the doctor and you can both watch it. The third thing is to give them a line drawing. Draw on the picture, show what the changes that can be done. Any morphing that is done cannot be reproduced. I do not morph. Lastly, but not in the least, most problems arise because there is a very clear or a very poor understanding of the doctor wanting what the patient wants and the patient not having the clear understanding of what the doctor is going to go do for them. So that's something they need to manage. Very, very important. Ask all the pertinent questions you need to know. What is the downtime? Usually no more than a week. When can you resume work? In about 7 days or so. There is a splint on top and some sutures that need to come out in 7 days' time if it's an open rhinoplasty. A rhinoplasty can be done as a closed procedure as well. Now, this is generally done under general anesthesia. You can have it done under local anesthesia. I would recommend that you have it done under general anesthesia. I had my nose done when I was in the US as a student some 25, 30 years ago. I'm very happy with it. Never looked at my nose again. So that is how you should proceed. Now, everybody thinks the nose is such a small little thing. It's an itsy-bitsy thing. Anybody can do it. It's the most challenging surgical procedure that there is. There's no room for an error. In the face, 1 mm is equal to 1 foot. So finding the right surgeon is very important. All the things that I said can be done. It's an ambulatory procedure. You can have it done, go home. Your nose is packed for 2 days. The back can come off and you'll be able to breathe freely. Generally, prescribed medications are antibiotics. some drops to reduce the swelling in the nose, and some pain medication. And at times, the doctor may also put you on a low dose of steroids or a pill called Chimera Fort, which will reduce the swelling. If your expectations are realistic, you'll be very, very happy with this procedure. Obviously, very crowded places, not recommended afterwards, so that you don't get elbowed and you have a problem with the nose. The most common risk involved with this procedure is bleeding postoperatively, generally managed very easily. I don't even remember the last time I had a nosebleed. Other things are infections, stuffiness, asymmetries. All of these occur because you have not seen the right doctor. I would also suggest that you go for a second opinion. The second opinion is not necessarily the endorse what the first surgeon has done. It may be entirely different. However, you will get an idea by meeting the doctor. How is the kind of doctor? Is he qualified? Is he approachable? Can you speak with him? Is he going to be looking out for you and holding your hand after the procedure is done? So these are things that's very important. You may also ask to see some pre and post-operative pictures of noses that the doctor has done. I have a number of cases that I have permission from the patients to show. Obviously, that will be shown in the privacy of a room, and you can watch that and see for yourself whether you like the results or not. Not two noses are the same. Now, lastly but not the least, according to a recent survey done by the American Society of Plastic Surgeons, as well as the American Academy of Cosmetic Surgery, as well as the Society of Facial Plastic Surgeons, most people were unhappy because they picked the surgeon based on their fees. If you will always get paid for what you pay for, it's very simple. You are paying not for the procedure, you're paying for the skill. It's an artist. So I leave you with this thought. Please be careful. Please do your homework. Please go for a second opinion and make sure what you're getting into. Lots of luck, and this was a pleasure. I thank ClearNet for giving me the opportunity for sharing my years of experience, over 25 years worth, with all of you all. Take care.